This project is called Learning for Action Across Health Systems. I'm Alex Jones and I'm the project manager. Learning for action across health systems means two quite simple things. It means learning lessons from other health systems, from the successes and the failures that they've gone through, and it's putting those lessons into practice in your own country. Learning is a tool you can use. You can use it for many different things. Learning from other countries, a particular type of that tool. And if you can make the tool useful and attractive, and countries choose to use it, then their capacity to improve their health systems might improve dramatically. So we've done various literature reviews. We've done 8 case studies across 8 different countries and 2 different continents. So that means dealing with 8 different bureaucracies just to get visas, just to get permission to do the research. Getting a visa for every country is different. Some cases you can arrive and you can apply for your visa. In other cases you need the Ministry of Immigration to send their approval to the embassy in London in our case, and then to go and apply. It's involved 2 international meetings bringing people from 4 continents. It's bringing people from every low-income country in Africa. So it's logistically very complicated and fast-paced to get it done. A major success story that I've seen on this project is a 30-year story in Cambodia that went from the 1980s, when Cambodia was just emerging from the Khmer Rouge, up until today. Following the Khmer Rouge, the health system, both in terms of the infrastructure and the health workers, have been completely decimated. And the country was relatively isolated, government not recognised by the United Nations. And it went from there in a variety of steps to having made amazing improvements, both in terms of its health service delivery and health outcomes. That started way back in the 1980s, with some partners smuggling in medical syllabus in their diplomatic carry-ons to be taught to start to rebuild the medical workforce, to international partners trying out new ideas in Cambodia, and at the same time many Cambodians going abroad to learn about, to get their medical degrees, to get their nursing qualifications, and coming back to Cambodia. They started to build both a body of medical professionals and a body of Cambodian policy analysts and researchers. From about 2000 onwards, the government started putting its own money into these initiatives that were being tried out, and the evaluations were showing some of them were working. And now they've taken the lead in nationally implemented health policies that are very distinctly Cambodian, but so much more internationally influenced than the country was back in the 1980s. So it's a major story of learning almost a whole system in 30, 40 years. The 3 words I would choose to describe this project would be fast, complex, and intriguing. Fast, because it has been so fast-paced and so many components of it to get into the 1 year. Complex, because it's been dealing with so many different partners, that being the other people involved in the team, both from the Bill and Melinda Gates Foundation and within the OPM team with the principals and the research assistants. But more than that, all of the people coming to the international meetings we've arranged, dealing with all of the different countries where we've been arranging case studies. Intriguing because I've learned so much on this project. I've been exposed to so much of the world. Prior to this, a lot of my work was a bit more focused on a smaller number of countries, and this exposure, particularly for me, exposure to Asian countries and to the Solomon Islands in the Pacific, has been completely intriguing and a new perspective for me. I really enjoyed being able to look at a reform over a 20, 30-year period. You hear a lot the phrase past is prologue, and that really became a sort of real for me on this, to see that everything was partly defined by what went before it and the overall path it's taken. And so that was really clear looking at the case studies, how the way the reform is today is a manifestation of what was happening 30 years ago, 20 years ago, 10 years ago, 5 years ago, and even yesterday.